Hello, everyone, and welcome back to the Boogie Board Tiki Bar. Today, I am delighted to be joined by Rahul Jain. He is the CEO and co-founder of Noble. You know him from LinkedIn because he's recently done a launch and has been everywhere. Rahul, thank you so much for joining me today. How are you?
Great, Kevin. Thanks for having me.
Yeah, it's a pleasure, especially because you are from a small town in Wisconsin and I am from a small town in Wisconsin. The first question we always like to ask people to understand their career arc is what you wanted to be when you grew up.
I grew up in Indian family, obviously, a lot of doctors. So I think I only knew what it was like to be a doctor. And so I think, as a kid growing up in rural Wisconsin in an Indian family, I think I, like every other Indian kid, wanted to be a doctor at that point. Obviously, like as I went to college, I got to explore other career paths. But, I think young Rahul was definitely an aspiring physician at the time.
Okay. And so you go to Duke, and I saw you were studying chemistry, and it looks like a few other things at Duke. And you're also a major tennis player. What is your focus like when you're in college?
Oh gosh, yeah. I mean, you'll even see my rackets behind me. I'll move the camera over, but in college, I was econ pre med, so took a lot of biology, chemistry courses, kind of the typical pre med curriculum. But then also, started taking econ courses, and that was actually my first exposure to like the business world. And those were the classes I really enjoyed. I thought there was a lot of things actually changing in healthcare at the time. From a business perspective, I mean, I graduated undergrad in 2012. So in 2010, the Affordable Care Act came out. Everything was changing in healthcare on the business side of things. And that's actually where my first interest was from a business perspective. And that actually eventually led to starting my first company in healthcare a few years after I had graduated. But for me in college, from a work perspective or from like a curriculum perspective, definitely economics, pre-med, and then, played a lot of tennis on the club tennis team at Duke as well.
And so take me through that transition because I was looking through and I see you're publishing papers about hip injuries in athletes at Duke. So you're pretty deep into the medical world. What is the journey like for you to decide to found your first company?
Yeah, so my first company, it was in like the pharmacy medication management space. And actually the inspiration for that company was like seeing my grandparents manage their medications and kind of the struggle that they had, as well as my co-founder, who's my roommate at Duke. He was actually diagnosed with cancer right after he graduated from undergrad. And so he went from being a healthy 22-year-old med student to then being on 10 medications a day and managing his meds. And we thought that if a really young, smart kid couldn't manage his meds, then this is a problem that other people had as well. And so Nick, was his name, like his experience became the motivation for starting our first company. And it was me and my college roommates. So it was kind of a way to get back together and work on something for a few years. But it was really his personal experience that served as the motivation for that.
Interesting. And you're really young at the time. You're like 23, 24. It looks like you spent a little time at Accenture. So you've had a foot into the working world. But what is it like for you being that young and you're full on, you're running a business?
Yeah, I mean, I think at that time, like you're jumping 2 feet in, but you're so naive, you don't really know what's going to happen. And I think the fact that I had really no idea how difficult starting a company would be, but I think that helped me get started because you're just like, oh, I'm working with my friends, we'll figure it out as we go. But I think that naivety like actually helped kind of get me started to start the company, go in full time with it. And it's a lot of just learning by failing, honestly. It's a lot of trial by error. And that is, what we did for years. Eventually, after signing a bunch of contracts with insurance companies, developing a product, and I can tell you more about it, we did shut down the company in 2019 because it wasn't growing the way we wanted. And we kind of could see the writing on the wall as well in terms of just like the market and some of the challenges we were having, but it was still a phenomenal experience to be able to found a company and learn as much as we did when we were still in our 20s.
Yeah, I mean, I checked it out, and you sustained for quite a while. So really cool experience it must have been. And the product itself, I think you should tell the listeners about because it's pretty awesome. Here, anybody who's had to deal with this like in their life, it just makes so much sense.
Yeah, no, I appreciate that. So we focused on helping seniors better manage their medications. So if your grandparents are on 5 or 6 medications, what we did is we worked with pharmacies where they pre-sorted all the patient's medications by dose. So like all your Monday morning meds would be grouped together, your Monday afternoon meds would be grouped together, your Monday evening meds would be grouped together, so on and so forth for the rest of the week. And then the pharmacy would mail these trays of all your medications pre-sorted for you. Then they would insert into a smart pill box that could actually sense when you removed your medications. So if it was say 11 a.m. on a Friday and you haven't taken your late morning dose, we could sense that the medications were not removed and then the pillbox had lights and alarms on it, but then we could send you like a text message or a phone call or email reminder as well.
Wow. Ahead of your time, I think, for sure. That's awesome. Okay. So you go on this kind of amazing startup journey when you're really young, and then you appear to go into sales after that at a healthcare company. So what is it like for you? You'd been thinking about pre-med, you go all into startup land, and now you're in the world of sales. Has it become your craft at that point? Are you just trying to, figure out what's next and this is what comes up? How did you land there?
I got very lucky. So when Tower View shut down in 2019, I reached out to the VCs that I had met, and I was like, "Hey, I'm unemployed. I need a job." And the one thing that I did get pretty good at, being the founder and CEO of Tower View, was selling to large health insurance companies. So I was the one effectively for the last 5 or 6 years at that point, selling to large health insurance companies and health systems. And so again, that's a lot of just failing and learning from your experiences. But I got pretty good at selling to the Humanas, the United Healthcares, the Blue Crosses of the world. And so when it came time to kind of figure out what to do next, I at that point, having started a company when I was 23, I wanted to learn from experienced entrepreneurs. And there was a company at the time called Uda Health that was founded by two very experienced entrepreneurs who had a lot of success in healthcare. They had built and sold companies before, and I wanted to learn from them. I knew my experience as a 23-year-old, kind of working with my friends and building a team, but we didn't know what we were doing. We were just like figuring it out as we went. And so I wanted to go into an environment where these are people who've had experience before. I'm growing this still very small team. I was the first sales hire on their team, but I would get to report directly to the founders. And so that was really appealing to me because I just wanted to learn at that point.
And were you willing to think about sales as your career path? Did you enjoy it at that point? What was your interaction with that, like being your title?
I definitely did not resonate with being a salesperson. I think like I always thought of myself as a founder, and as a founder who did sales versus just being, an account executive or being a sales rep. And so I think shifting from like a founder as a title to doing sales, I think you don't have the same title. You don't have that same like gravitas as you're entering these meetings, because like people want to talk to the founder, they want to talk to the CEO. They don't necessarily want to talk to the head of sales at a company. And so it's like, it's harder to get meetings. You definitely have to pull in your CEO to kind of have those other executive conversations. But I do think that I was just very lucky to be in that environment where I was surrounded by exceptional salespeople. So the CEO and founder of this company, he had a sales background, as did a few of the other executives. And so even though I was the first formal sales hire, the rest of the executive team around me, they all had a very, very strong experience in sales, and specifically selling to large health insurance companies, which is a very difficult sales cycle for anybody who's had to like navigate that.
Yeah. What's different about that type of sales cycle?
It's I always joke that if I had $1 million and I tried to give it away to a health plan, it would take 18 months to give away free money to a payer. It's a very, very long process. Getting all the stakeholders aligned internally at a health plan, that will take about a year to do. There's just a lot of stakeholders that you have to be able to get on board. Budgeting for the next year it just kind of depends on when that contract is coming up, and then going through a very long procurement process, and also going through legal review with any contract. So even if it takes 12 months to get the business approval to move forward with whatever you're selling, and getting the business case approved, going through procurement and then legal review of a contract can take another 6 to 9 months on top of it. And so they typically start with contracts or pilots that are very small. So it's not like, oh, you sign a big contract with United Healthcare, with a Blue Cross plan, and suddenly you have access to millions of their members. No, they'll typically start you with just a few thousand of their members. So after like a 18 to 24 month sales cycle, you may only make a few $100,000 in revenue. And then you have to kind of re-up and kind of expand to a larger pilot from there. And there's this term in healthcare that we call pilot hell, where it's like you sell to a health plan, but it's all these like little pilots that are incrementally larger. But then it might take 4 or 5 years to have like a full rollout across their book of business. So, they're very risk averse. They want to try and see how things work. But for an early stage startup, that's difficult because you're going to run out of money unless like you either raise more or you have multiple contracts at the same time.
Yeah, it takes your athletic background is coming into play there because it takes some incredible endurance and sort of a positive spirit to complete a sales cycle like that. I'm curious if there was like one maybe in your early days or during your time in sales leadership where you like felt like it was the biggest challenge that you faced, or a single sales cycle that like you learned the most from.
Gosh, I mean, I think everyone is difficult. Like there was never a sale selling to a large health insurance company where it was easy. And like your goal for the year could be 4 contracts for the entire year, and that would be a great year for anybody selling into payers. There were so many times where you would get through the business case, get everybody aligned, you go through legal, you go through procurement, and then things get hung up on implementation. So even after you get the contract in place, and like that's really frustrating. We've definitely had times where you get, the contract in place, you go through the whole process, and then your stakeholder leaves the organization. And so you kind of have to start from scratch. There were just many times where you thought you were good. Like you had everybody
Yeah.
aligned, like you had the budget, you had like the payment set, the legal was on board, you got through procurement, you got through the IT security review, but then there was always something at the last minute. And those were always really hard because you put months, if not years, into that deal for something to fall apart like at the 1 yard line.
Yeah. No, that makes sense. And so I'll fast forward a little bit, but you grow on to lead sales at Cedar as well. And people like you, I find great salespeople are also great hackers because they're looking for ways to cut through processes and make things smoother. So I'm curious, at what point in your journey did the idea of Noble start to manifest?
Yeah, I mean, the idea for Noble actually came from my first company, Tower Review. So one of the reasons that we failed was we would sign these big contracts with the health insurance companies. So like Humana or United Healthcare, they would give us access to like 500,000 of their members. And they were like, okay, here's a list of 500,000 Medicare Advantage members. You figure out how to sign them up. And if they sign up, we'll pay you. So it was essentially was like a license to hunt across their membership.
Interesting.
Punch we had is, okay, here are 500,000 70, 75-year-olds all across the country. How do we get in touch with them? How do we actually convince them to try our product? Even though it's free for them, it's completely covered. Like, but we still need to get in touch with them. They still need to opt in to using our service. And as a bunch of 24, 25-year-olds, we're like, okay, like we can't target them with ads on Facebook or, on Google because they're not on those platforms. We can't email them because we don't have their email address and we can't figure out like how to get in touch with them digitally. We could send them a mailer, but that's way too expensive because if we're mailing this out and like our contracts, they were good for like on a per user basis, but that would be after they start using the product. We didn't have customer acquisition cost baked in to our financials. And so the only thing that we could think of, which is unfortunately what a lot of companies do when they're selling to within healthcare, is that we essentially hired a call center in the outskirts of Philadelphia to cold call these patients. And it was horrible. Like we had maybe like a 1% conversion rate because the vast majority of people wouldn't pick up the phone. The phone numbers we had were disconnected. And then if they did pick up the phone, then we were able to convert 20% of them to trying out the service. But it was just, it was a funnel problem. We were not able to convert enough of them. And so our cost of customer acquisition was a few $100s. And we just didn't think about that. We just thought that if we sign a contract with an insurance company, they will get this to their members. And that was something that we kind of learned in the process, that just because you get the payer to pay for it doesn't mean you actually have users on the other end of it. And I say that because I always thought at the time that if I could tell a 65-year-old, a 70-year-old that like, hey, your friend uses this product, reach out to him or her, ask them about their experience with it, that person would be much more likely to use it because they get to talk to somebody that they know and trust about their experience. And nothing like that really existed. Like I couldn't tell that prospect that, hey, like, don't take my word for it, like reach out to your network, or hey, this person uses it, like chat with them and see what they say about it. And so that was actually the initial like idea behind Noble, because it was a problem I had at my first company. And I think it's like one of the many reasons it failed, but that kind of stayed with me because I did think that it would help us with our first company, but then also like, this is just how I buy things. Like if I have a high consideration purchase to make, if I'm making a decision that's important to me, like, yes, I'll Google it, I'll learn more about it, but I'll almost always reach out to my network and my friends to get their feedback. And especially today in a market where there's more solutions than ever before, there's more software companies that are kind of cropping up, there's more tools out there, and there's also more noise. Like you're getting constantly bombarded on email, you're getting constantly bombarded on digital channels, like you're starting to tune out ads. this idea of going to people who you know and trust that use the product, it resonated with me more and more. Long answer to your question, original inspiration for my first company and one of the challenges that we had, but it's also something that like I myself would use. And that's why I kind of always believed in this idea.
No, that's an amazing answer. I hadn't thought about it from that angle of healthcare. That must have been maddening to have made an incredible product and not be able to basically give it away for free to people that it could really help. But for those that don't know, you can go on a website and see which of your friends or other connections use that product by checking out via Noble, and then just ask them for a real review. And it's really interesting for me from a sales standpoint. I think about how to enable those types of conversations. There's so much distrust now for any type of media, any type of posting, even on LinkedIn. And so I think it's a really needed avenue. So it feels like you've morphed into a new space, though, that you're also looking at SaaS companies now. So how have you decided on which products that this will work?
Good question. And so my co-founder Josh and I, we started talking about this idea a few years ago, and we always believe that when it comes to a high consideration purchase, that you want to talk to people that you know and trust that use that product, but there's no easy way to do that. And one of the first questions we had is like, well, where do we start? Like, what types of products do we start with? And initially, because Josh and I both come from healthcare, we were like, well, how do you find your dentist? How do you find your orthopedic surgeon? How do you find your dermatologist, your pediatrician, your OBGYN? Like, those are all word of mouth. You're asking people you know, your neighbors, your friends, like, hey, what dentist do you use? Or like, if you're going to get a haircut, like, hey, who do you use who's your barber? Things like that. And so initially we thought, okay, let's go to the health systems that we know, because that was our network at the time. Let's go to these hospital systems and say, hey, would you guys want to use this as a way to get patients to essentially like market your product, so that if you're a patient in Philadelphia, which is where I had lived before, and you're looking at, Penn Medicine, can you see who you know that went to that dermatologist at Penn Medicine? And then based off that, you can ask them like, hey, how is this? And then if they say they have good experience, then like your friend can direct you to either that dermatologist or just whoever they know that you use that dermatologist or that physician. We actually got Penn Medicine on board with doing this. And so like we were able to figure out like all the HIPAA issues, all the legal privacy issues to design it this way. But the reason that we didn't move forward with healthcare is we realized that getting one health system on board didn't necessarily mean we would get the next health system. Like, there wasn't a growth loop with that. And so we kind of took a step back and we're like, because having done sales before, I didn't want a company that needed a big sales team. Like, I'm fine with like a few salespeople here and there, like focused on the enterprise, but I wanted growth loops in the product, and I wanted a market that would be amenable to, and that you don't really see that in healthcare. So we kind of took a step back from healthcare and we're like, okay, what are consumer products that we know people ask around about? And so we explored like baby products. So if you're an expecting mother, essentially you put together typically a baby registry. You ask your friends for recommendations on which products to get, because the first time around you don't really know what to get. We definitely saw that people were talking to their friends about like, hey, what products should I get? But I think two males starting that company didn't seem right, because like everybody we would interview are like, they're always like, why are you guys starting this company? Because neither of us had kids at the time. And so it was just like, it was not natural to start with baby products in that market. And then we kind of went back to the drawing board and we're like, okay, we've been in B2B for a while. What if we just start with just typical B2B software? And specifically, what if we start with sales and marketing software? Because there are tens of thousands of sales and marketing tools out there. But specifically, there was a nice growth loop associated with these, where let's say you're a marketer and you're evaluating like Cognizant, for example, or demand-based. So you're on like a marketing software website, the vendor's website. If you're a marketer and you see Noble on that website, where Noble's a banner on the site that says, want to see who you know that uses the product. Yes, you as a marketer or a prospect can see then who in your network or who you know personally uses that product, so you can reach out to them. But as a marketer, when you see that, you're going to be like, that's really cool. Yeah. I want to add that to my website as well. Yeah. And so that was the growth loop that we were kind of looking for. And we saw it within B2B SaaS. It was a big market, in terms of raising money. Like, people understand B2B software. Like, it's not as risky as like consumer products are. From a legal privacy perspective, we can get a customer list pretty easily within B2B SaaS. So those were kind of the reasons that we ended up starting specifically with B2B software and then sales and marketing tools as kind of the vertical, because there was a really good growth loop where our users could then become our customers. And what we actually end up seeing in our beta or early access is that we had 50 customers live, over 500 on the wait list, but about 3% of all of our users, so prospects who use Noble, they would then go to our website and then join our wait list. So we were already starting to see this in the early days, where if you're a prospect and you saw Noble on that vendor's website, you would then come to our website and then join our wait list because you're like, hey, this product could help me and my company as well.
Well, your growth loop works. It's the reason why we're having this conversation. I know I sent you an email because I was just like, I'm seeing y'all everywhere, and it's aspirational. As a founder, I think about having testimonials in that kind of sense of like, this person's face is on my website and people can come and know that their friends use it. It just cuts through so much. And what you said about the products that you're choosing also makes sense. If you think about baby products or healthcare services, you're not buying them as frequently, whereas a SaaS buyer tends to be, doing that more frequently. It's a little more sophisticated. I think it's awesome. So tell me, you've been doing this launch. How have you been going about getting the word out? Where are you? What are you thinking about right now?
Yeah, so we are officially live. On November 19th, we launched formally, kind of out of beta. Right now, you can go to that'snoble.com, sign up. The onboarding now is really simple. We actually automate pulling your customer list, your logo, your colors, things like that. We just give you a nice Google Tag Manager script to add to your website. But the launch itself was it actually went a lot better than we were hoping, than we were expecting. But the preparation for the launch actually happened like months before, in the sense that like we built this phenomenal advisory board. And these were mostly B2B SaaS sales and marketing leaders that were pretty prominent on LinkedIn. And so we got lucky in the early days. Actually, like our first potential customer, Jason Widup, who was leading marketing at Metadata at the time, when we first approached him with just an idea. So we had a Figma mock-up of what this would look like. He saw it and he's like, I love it. Like, this is something I've always thought would work really well. I later learned that he tried to start a company that was similar to this a few years back, but never could really get it off the ground. So like, he was really bought into this concept and the importance of word of mouth in the buying journey. And Jason went from being our first like potential customer to becoming an advisor. And then eventually he left Metadata and he joined as a consultant or as a contractor for Noble,
Awesome.
kind of leading our marketing. So he has been incredibly helpful. And like, we wouldn't be where we are today without him, because he essentially took our idea and he was like, hey, you need to talk to this community of B2B marketers. So he made like 50 introductions to other B2B marketers that are very well known in the space. These are marketers who, lead marketing at, well-known B2B SaaS companies. And he would make the intro so I could introduce myself, show them what we're doing at Noble. And I'd say like, hey, we're looking to build this marketing advisory board. There's no payment, but we'd love to have you on board just to get your feedback. It's very low time commitment, but we want to learn from you and we would really benefit from any feedback that you could give. And fortunately, because Jason made the intro, like I think almost everybody said yes to that. And so we have like a Slack channel of, close to 30 or 40 just phenomenal marketers, where if we ever have a question, we just shoot that question into the Slack channel and they'll give us feedback almost immediately. Kind of that process of building that advisory board over the summer, getting to know them. And so when we were ready to launch in mid-November, like a week before, we're like, hey guys, like we're going to launch, we'd love your support in like posting about this launch on LinkedIn. And so we were able to coordinate with our like marketing advisory board, with our investors, with just other like friends and family and like people that were supportive of Noble. And we would give them like a template of what to post. And then when November 19th came around, we would essentially have the first post that would go out. And after everybody would post, they would essentially like Slack their post into the Slack channel so that other people could see it and just kind of build momentum. They're like, hey, we're all doing this together. Yeah. And that helped tremendously. We ended up signing up more customers that day than we had like projected for the entire month. So It went really well. And I think it just created a lot of buzz as well on LinkedIn.
It definitely did. I've loved, seeing it happen. The whole kind of no bullshit ethos of your company shows in the stuff that you're posting, real emails, real testimonials, your actual plan. So I'm just glad to see that in the space. So I only have one more question because I know we're running out of time. You are now a very busy CEO and founder again. Are you still good at tennis?
I try, for sure.
Do you get to play? Do you get to play at all? I saw you play pickleball. You're very good at pickleball.
Luckily, a lot of the skills carry over between pickleball and tennis. In the summer, I definitely try to get out there like once a week or so. And it's very easy, for things to come up and be like, no, like I'll just go work out or I'll do something else besides playing. But, I luckily have a very supportive wife who kind of pushes me to go play because it's something that I do enjoy doing. But in the summers when the weather is nice here in Kansas City, where I am currently, like, I try to get out there at least once a week. We've met a lot of people locally who are just phenomenal at tennis, a lot of people who played in college. And so it's very competitive. It's fun to get out there. Also, my co-founder, Josh, is a phenomenal tennis player as well. He actually played at Hopkins.
Wow.
So he was kind of recruited to play there. So it's fun when we get together because it's like, yes, we'll talk about work, but we'll also try to go play tennis at the same time. And I think actually when we raised our first round of funding, Founder Collective, Micah, the partner there, took us to the U.S. Open, which was cool to go together because Micah's also a tennis fan. So long answer, but yes, I try to stay active. I try to kind of keep playing because I think it's very easy to kind of lose some of your interests and hobbies as you get busy with work and family and everything else. Try to be intentional about playing every once in a while.
I love that. Good for you. Good for your wife for pushing you to do it. And thank you so much for taking the time to chat with me while you're going through all this with the launch and the end of year. I really appreciate it. We're going to post a picture of the screenshot of Noble so folks can see what it does. And we'd love to stay connected and have you on again.
Awesome. Well, thanks for having me, Kevin. And yeah, whenever you want to have me back, I'd be more than happy to join. So thank you.
Thank you, Rahul.